Hi, my name is Marcita Wilson Coleman. I'm a physician with Women's Health Centers, Kissimmee. I'm asked today to speak on the issues concerning Essure. So for those of you who do not know, Essure is a now permanent sterilization procedure that can be done in the office or in the hospital, but it is a vaginal approach. It does not require any incision. If it's done in the office, it can be done under local anesthesia. In the hospital, it's usually done under general anesthesia. However, the coils are placed through the vagina into the uterus and then into the fallopian tubes. These coils are placed appropriately so that after a prescribed 90-day time frame, there should be scarring of your normal fallopian tube mucosa around the tubes, which then will cause a scarring that will block those tubes and therefore prevent pregnancy. It's 99.9% effective, like all other permanent birth controls. There's nothing that is 100% effective except abstinence or not actually having a uterus or ovaries in general. However, after Essure is placed, we usually do a follow-up ultrasound called a hysterosalpingogram, in which fluid is injected inside of the uterus and then through the tubes, and occlusion can be confirmed through this testing. In a very rare cases, we have some patients who end up with some pelvic discomfort or pain associated with periods, ovulation, and sometimes intercourse. This pain has been ruled out to have no other causes except for possibly the recent Essure placement. After a thorough evaluation by your gynecologist, if the decision is made to remove the Essures, it can be done one or two ways. One, you could have a laparoscopic removal of Essure, in which an incision was placed at the umbilicus, and one or two incisions can be placed in the abdominal cavity. Under direct visualization, the tube can be transected or cut, and that is called a salpingectomy. So we remove the remaining tube that's there, and then the Essure coil will be identifiable, and then the Essure coil can be gently removed from the corneal region of the uterus. So in the end, the patient does not have the Essure coils any longer, and they no longer have both fallopian tubes. It is safe and quick and simple and effective as any other birth control method, and patients recover very well just having the laparoscopic incision. There have been also cases where the attending may decide to do a complete hysterectomy, and that is in cases of people who have some long-standing histories with chronic pelvic pain, pain associated with the uterus, uterine fibroids, or any other gynecological conditions that will warrant a hysterectomy. Then the uterus and tubes can all be taken together, and the Essure coils will then come with those tubes that are removed. There are some techniques reported where the Essure coil can be grasped through the hysteroscope, which is a scope that goes inside the uterus, and the coils can then be pulled back through the endometrial canal. This can be associated with some larger issues in regards to bleeding. So in our practice, we traditionally will just do salpingectomy and removal of the Essure coil laparoscopically. If anyone is interested in consultation in regard to your Essure, please contact us at Women's Health Centers. Our number will be provided for you below. Thank you so much.